Welcome, Dr. Kwok. You just started your research fellowship training here at the Osher Center for Integrative Health, and I would love for you to share with all of us a little bit more about your research.
My research area centers around gerontology, long-term care, and behavioral medicine. And as an assistant professor of the University of Hong Kong School of Nursing and the associate director of the Center on Behavioral Health, I'm a nurse and also yoga instructor by training, whose work is closely linked to these integrative healthcare approaches. And specifically, my ongoing project investigates the effects and mechanism of different kinds of mind-body therapies. For example, yoga and meditation for people with Parkinson's disease. I'm also interested in leveraging technology to help scale the implementation and maximize the impact of these integrative care models.
And what led to your interest in integrative medicine and yoga therapies and mind-body therapies that you mentioned?
About 15 years ago, when I first started as a nurse, I knew I need to find ways to really strengthen and stretch my body. There are lots of physical demands of SI care, right? And this led me to start practicing yoga, which seemed a practical solution. And over the years, as I continue my yoga practice, I exposed to a wide range of styles from hatha to yin yang to vinyasa and so on. And I found that my body and mind respond quite differently to these techniques. And what began as a physical endeavor evolved into something much deeper and connecting my mind and body and bringing a sense of spirituality and making me feel more grounded and peaceful. As a nurse, I had been taught about the importance of giving holistic and compassionate care. However, the significance of self-care is not just about the lifestyle modification or stress management, but it's a more skillful philosophical way of living had not been emphasized in our nursing curriculum. And I realized that cultivating a strong and resilient mind is essential to be a cool nurse so that we can stay calm and work efficiently in the face of daily emotional disturbance, compassion fatigue, and even conflict among patients, relatives, and colleagues. And practicing mind body exercise like yoga and meditation has helped me develop this inner strength and resilience, which is essential to provide high quality of care in the demanding field of nursing.
So, what surprises, if any, have you encountered as you've gotten further and deeper into this work?
Yeah, as a behavioral scientist, I would say the biggest challenge that we have are the disruption caused by the 2019 social unrest in Hong Kong, and
Mm.
also, of course, the COVID pandemic. And these external factors significantly affect our implementation plan. Yet, I'm incredibly, really proud of my resilient and dedicated research team for carrying our study participants throughout these chaotic times. And another surprising finding is that we find some surprising results from a recently completed study. We compared two different types of mindfulness approach: mindfulness in stillness, meditation, and mindfulness in motion, yoga, for people living with Parkinson's disease. And we include a wide range of outcomes, including mental health outcome, exacerbate physical functioning outcomes, and also some inflammatory markers. And as an enthusiastic yogi myself, I had expected that yoga may resonate and benefit patients more. However, the data showed that patients respond better to meditation for managing their psychological distress. And these findings have challenged my assumptions and inspired new questions about the differential mechanism of mind body practice. And it's always a humbling reminder that as researcher myself, we must remain open-minded and let the data guide us non-judgmentally.
That's right. So, what impact do you hope to have over the next 3 or 5 years?
Um, for the next 3 to 5 years, I hope to upscale and enhance the sustainability on these like evidence-based and integrative practice in our healthcare system. And I'm excited to have secured a 1.6 million donation to develop a comprehensive and community-based Parkinson's care program. And this initiative will complement the existing system by providing capacity building, public awareness, professional training, and robust patient and caregiver support. And my goal is for this project to generate meaningful and lasting benefits to empower the Parkinson's community with greater resilience, acceptance, and well-being. And another key aspiration is to see compassion-focused resilience training become an really accredited standard component of nursing and medical education. Cultivating compassion should be an essential competency for all healthcare providers, and I'm committed to drive this change.
Very nice. And so last but not least, what do you hope to accomplish during this mini sabbatical that you're completing with the Osher Center?
So this is my first week here, and I'm deeply grateful to have Dr. Peter Wang, a compassionate pioneer in integrative health, as my mentor at the Osher Center. And the welcoming Osher community is filled with all kinds of compassionate and brilliant scholars. And we share similar research interests, so I can't wait to really meet and connect with them. I'm excited not just to learn, but also to contribute and explore synergy. And beyond knowledge exchange, I sincerely hope that we could build meaningful connections and a sustainable network for a lasting positive impact. And I look forward to fully immersing myself in this dynamic and resourceful Osher community. And by integrating the traditional wisdom and modern insights, our efforts toward integrative health, I believe, could lead to a better world for the next generation.
That's wonderful. Well, we welcome you with open arms, and we're so glad that you're here and will be spending time with us. And thank you so much.
Thank you, Shannon.